Well, good afternoon to all of you. It's already 2 o'clock, so if it's okay with you, we can start the webinar. First, let me introduce myself. My name is José Jonay Ojeda. I work at Hospital La Paz in Madrid. I'm the coordinator of the Quality and Safety Working Group. And I have the task of presenting this webinar around the monitoring data that we have collected and presented. The last board of the network meeting we had. I would like to tell you that this webinar is being recorded, so please be aware of that. The idea is that those of you that are not able to attend the webinar in the streaming, that those of you that are not able to do it, they can watch it later on, because we will upload it in the TransplantChild website. But in any case, please feel free to interrupt me in any time of the presentation, because that's also the idea of this webinar, that we can discuss about this topic online. Let me ask you, you can see the slides correctly? Yes? Thank you very much. So, as I was mentioning before, my name is José Jonay Ojeda. The technical director of this working group is Dr. Wember from the Karolinska University Hospital in Stockholm. And the idea in this webinar is to talk about what is the monitoring scheme in our ERN in TransplantChild, some summary results of the last assessment that we have asked from you as healthcare providers last year. We will discuss not only about the transplants that have been performed in the centers of the network last year, but also we will present what is the summary results according to the patients that we are following after transplantations in the outpatient setting. But also we will also talk about some of the training activities, clinical practice guidelines, and other clinical tools that you have shared with us, and also the research activities, meeting and congresses where the activity of the network or its results have been presented during last year. We will end the webinar talking about what are the following steps that we will be undertaking about indicators and surveys in our network, and a brief message to take back home. Well, this is the overall view of these first 5 years of functioning of the European reference networks. As you already know, there was an initial assessment and an approval almost 5 years ago. Since then, we have been doing some surveys that we have asked every representative to fill out in order to monitor not only specific indicators in relation to pediatric transplantation, but also some information that the DG Santé, the European Union, asks to every European reference network every year. In fact, last year, 2020, they asked for this information twice a year. So that is going to be the proposal for this year too. We will have 2 periods of collection of this information, and for every period we will send all the centers a survey so we can collect the activities for the first semester of 2021, and also by the end of the year of the whole year. An important issue is that during this year we have been collecting and monitoring the information of the original 18 full members that joined the network. But as you know, last year, due to the Brexit, we have 1 less full member in our network. the King's College of London, and we have added 9 new affiliated members that we have asked for the first time to share with us their activities too. This is the current picture of our network. As I mentioned, 9 affiliated partners have joined the network last year, and representing 7 member states. And it is expected that by the end of this year, we will finish, I mean, the European Commission will finish the evaluation of the new full members that applied almost 2 years ago to join our network. And well, you have the list there. That will mean that we will have 15 healthcare providers more in the network, and also 4 member states more represented. As I mentioned before, this is our setting. We have an information system that you already know, the clinical patient management system. In this system, we collect, and the European Commission monitors what is the activity in relation to the virtual consultations that you know that we can take through this tool, but I will not refer to these results in this webinar. We also ask from you, from the healthcare providers, activities in relation to your local databases and records in relation to the transplantation and the follow-up of those patients. We also ask from you other information regarding the results of the outcomes of transplantation, like the survival, for example. But as I mentioned, that information, we don't obtain it directly, but we ask it from you. As the coordination center of our network, we have records also of the activities that we undertake as a whole network, and where several different healthcare providers participate, and we collect the overall surveys that we ask from you. As you can see in the slide, we did the first survey in 2019, the second in 2019, and this last year we have done 2 surveys. And finally, the European Commission itself have some administrative records that are also collected automatically in order to monitor the members, or the number of healthcare providers participating in our networks, and also the participation of the member states and the patients' organizations that are collaborating with each network. As you can see in the slide, the idea is that after these first 5 years of functioning of the networks, this data that we have been collecting and providing to the European Commission in the monitoring system will be used to establish future grants of our networks. So that's something that we have to keep in mind. And especially that the European Commission is interested in getting to know how many patients, how many European people is in relation with every reference network. So that explains why in the last surveys we have asked from you not only the information about transplantations that you are undertaking in your centers, but also the numbers of patients that are taken care of after transplantation in the outcare setting, and that it's usually in the outcare setting until the transition period comes into place. This is summary results of the last survey that we launched to you. This survey, as I mentioned before, was aimed to collect the data of all the year 2020. It was launched last 16th of February to the current, as I mentioned before, 17 full members and the 9 affiliated partners representatives. And well, in the first place, we had to stop to include more activity at the end of March, because in that date was the date established by the European Commission to put into the monitoring information system that all the networks have the information from last year. So the participation details for this last survey was that finally, until the date of today, 3 healthcare providers could not participate, mainly affiliated partners. 2 healthcare providers, 2 full members provided activity later than that 31st of March, but we have included that information in today's webinar. And 2 healthcare providers, 2 full members, could not provide us yet outpatient activity. So we will insist them, and we will again remember in this webinar that this specific information activity is also a very strong point to not only to our network, but to all the networks in order to keep growing within the European Commission setting. Last May 24th, we sent an email to every representative in order to ask for the validation of these results. Today I can present you the data where 13 healthcare providers have already answered and given us not only the validation of the data we presented in the last board of the network, but also they have amended and provide additional information. And that means that our overall numbers, including all the activity collected from all the members, consist in 696 transplantation performed in 2020, including the 6 types of transplantations that we have in our network, and also 5,213 patients attended in transplantation in the follow-up clinics. So, as you can see in the slide, not in many occasions you can put together so many patients, and that's a strong point, and that's something that we have to stress out very possibly. This is one of the first slides that we show you in the last board of the network. You have in this slide the activity that each of the 17 current full members have provided us in the liver transplantation program, kidney transplantation program, intestinal and multivisceral transplantation program, multi-organ transplantation program, lung, heart, and hematopoietic stem cell transplantation program. So you can see that, depending to the history, and the development of the different programs in every center, we have different numbers. But as I told you before, join all together, it's something very positive, because it gives us a good position in relation to the other networks that I mentioned before. That's the information in relation to the transplantations performed in 2020. And for this slide, you have the information, again, in the same type of transplantation programs, but in relation to the patients that you have reported us that are being followed up in the clinics last year. Again, the data are very important. In this case, you can see that 2 centers, 2 full members, have not provided us with this information. But as I mentioned before, it is still possible to answer us that email that we sent last 24th of May, and we can complete it. Again, if you see some data that is not correct, please do contact us, because that's the idea, that we can validate and put together all this data together. This is the information that for the first time it has been asked to the affiliated partners. You can see that from the 9 affiliated partners, 6 have answered us in relation to the transplantation activity they have undertaken last year. Being an affiliated partner doesn't mean that you cannot have some transplantation activity, and we can see it in the slide. Sometimes some centers do have, but I think it's also very interesting to see that. Oops, sorry. This is the transplant. Sorry, it was the wrong slide. This is the slide showing the transplantation activity of our affiliated partners. Only 3 of the 6 that have answered the survey have report us that they do transplantations in their centers. And if we look about the information that tells us how many patients they follow up in clinics, well, another 2 centers, they do not do transplantations, but they have patients in follow-up. And one of them has told us that they do not have patients in follow-up, but they are still eligible to be affiliated partners, as you already know. If we talk about other activity that you have provided us, and that, as I mentioned before, is asked by the European Commission in order to show the impact, the outcome that the networks are having at the European level, I want to show you that in relation to the training activities, last year we collected a total of 27 webinars as this one. One of the objectives of the aims of these webinars is that it's also a tool in order to train and communicate inside the network. So those were the numbers of last year. Last year we did a workshop, an online workshop. It was the second TransplantChild workshop on translational research, and that is also a training activity that we have reported to the European Commission. And 7 healthcare providers, 7 of you, reported us a total of 36 activities that could be that has been also reported as training activities of the networks into the monitoring system of the European Commission. In relation to the clinical practice guidelines that we have produced or other types of clinical decision-making tools, well, we have included that last year, one center provided us with 4 clinical practice guidelines that have been adopted as guidelines of the networks. I can advise you that that's one of the possibilities. We are, as you already know, developing our own clinical practice guidelines, but if you have clinical tools in relation to medicine evidence, you can ask our network to adopt it and to have the support of the TransplantChild network. If we talk about research activities, last year we reported a total of 3 clinical trials where 7 different healthcare providers of our networks are already participating. That's something that we are interested in promoting. This last board of the network, we send you a proposal so that you all can participate as a research activity. So that's something that we have to keep promoting. And we also reported 3 publications, one on clinical transplantation, another one in the Orphanet Journal of Rare Diseases, and the other one on the BMJ, where we do not also, where several of the healthcare providers are represented, but also in this case, it's compulsory that in this publication we have to acknowledge the participation of the network. And in those 3 cases, if you don't know these publications, we can provide you them, and that's something that we have to promote and increase in the following years. And finally, again, we ask from you. We have some records at the technical secretariat of the network, but we also ask from you that if you have attended to any meeting or any congress where activities of our network have been presented, And in this case, we reported last year 11 meetings. And in this case, we had four of the healthcare providers that provided us with this information. Well, so as you can see, we have a lot of information in the technical secretariat, but we have, we are sure that if you keep participating and showing us what you are doing in relation to paediatric transplantation, we can get more results as a network. So what are the following steps that we are proposing in order to improve indicators monitoring this year? Well, as I mentioned before, this year we will be doing 2 surveys. We will be sending the representative of each hospital a survey in order to collect this information. One will ask about the information in the first semester of the year. We will probably launch this survey in July, August. The European Commission will ask for this data in October. And we will ask for the overall activity or the overall results of the year next year, around February, like this year, because in March, we will have to provide information from the whole year. The idea is that this year's survey, this year's survey, have to be more easy to understand. We will try to simplify questions and the answers available. We will redesign the survey to make it more visual and user-friendly. And we will provide you, to every representative, what are the previous data that we have collected from you, so you have that reference in order to provide us this year data. We have to keep in mind that all this information, the European Commission is asking every network to upload it in our website, in every website, because that will be the proof that these actions are taking place and they are real. And as you can see in the slide, our goal is to help you to be in contact with every healthcare provider to facilitate the participation of you all. You may have probably asked here that this is a critical issue, because if some of you is not able to participate, that will be one of the issues to be evaluated in order to terminate your participation in the networks. As I mentioned before, we need to have evidence, not only the data. So we publish those evidence in our website, and that's something that we have to work on this year. And well, that's the following step. And if you want, we can talk about that at the end if you need some extra explanation. And finally, the last slide. 4 messages that we want to give you. The first one is that this exercise that we do twice a year is critical for consolidation and further growth of our network. As I mentioned at the beginning, the evaluation of future multi-annual grants will be linked to this participation, and non-compliance in reporting data should be linked to termination of health provider participations in the networks. We ask from you to validate the data collected from last year. As I mentioned before, 13 centers have already do it, but please, if you have not do it as soon as possible. And please be ready to report this summer the activity of the first 6 months of this year. And if you need help because you have problems in obtaining this data, or you don't know if there are transplantation programs in your hospital that are not active giving this activity, please do ask us. Again, we ask from you to promote and report joint activities with other healthcare providers. Remember that in those cases, there has to be a specific acknowledgement of the ERN membership, especially when we disseminate the results. And as I mentioned before, the deadline that the DGCT has told us to collect the mid-2021 data will be in October, but we will send you the survey before. We are in the process of reviewing, updating, and launching this new survey. And as I mentioned before, this survey is mandatory not only to the current full members, but also to the affiliated partners. And thank you very much for your attention. I don't know if you have any question, please feel free to open your microphone and we can talk about it.
Hi, Jose. I am Victoria from the Paz University Hospital. It's the first time I am participating in this meeting, and I thank you for this very clear presentation. I have a question about the results of 2020. There is an impressive number of 696 transplants, but I wonder if the follow-up, that there are more than 5,000 patients. My question is, are patients in follow-up or are contacts? So one patient can come 3 times of the follow-up. So
I understand. Yeah, if they are patients or they are visits. No?
Yes, contacts with the healthcare provider.
Well, I can try to answer it. When we have in previous surveys, we have asked from you both data, not only the patients that you have active, and I want to specify that in some healthcare providers which perform transplantations and which follow up the patient, they don't do it all the time. I mean, there can be the possibility that that patient is referred, or has a referral to other center. So we are asking for the patients that you have active. If in the case that patient has been referred to other hospital, then it's not active. And if that patient has arrived to the transition period, then again, when it's in the adult setting, it will not be active again. No, it will be in the adult setting. It will not be in the scope of this network.
Okay.
So what I can tell you about the data we have received is that in general, as healthcare providers which perform transplantation, we have more experience in collecting data from transplantation, and we have less experience in collecting data of the patients we have follow up. So there can be differences that in that slide that are explained because perhaps we are not understanding the same thing. Okay. But as I mentioned before, one of the objectives of this year's survey is to make it a very easy understanding. So we will do an effort to ask you probably less information that we asked from previous years, but we will try to put examples and things in the survey that makes it easier to understand what we are asking for. What we are asking for is active patients that are in follow-up clinics in the same center. I mean, in the center, which is the member of the network. I mean, we can also have the example that you don't do the transplantation in your center, but you do the follow-up. So we are interested in that follow-up.
Thank you, Jose. Very, very impressive data, really.
Thanks to you. I don't know if you have any other question. We have other people joining the webinar. Well, it's already 2:30, so I think it's the date that, I mean, the point when we can finish the webinar. I thank you all for your participation in the webinar. As I mentioned, and you can also tell your colleagues, we will upload this webinar in the website of TransplantChild. And again, we are at your service in any issue you want to clarify after this webinar. Thanks to you all. Good afternoon.